Welcome to my podcast. In this podcast, I will speak about insomnia. It's one of the most common encounter, generally speaking, in the clinical setting. So basically, the patient will come to you, and after you introduce yourself and double checking the patient name, date of birth, and the address, you will ask the patient, "Tell me what brought you to the surgery today, or how can I help you?" Basically, so the patient will tell you, "I'm having trouble in my sleep." So you will ask the patient, "Could you tell me more?" Or ask how it started. Do you have any problem in your life? Do you have any issue that you feel might affected your sleep? For instance, like, breakup in relationships. Or if there is issue financially or work-wise, so the patient might be depressed, for instance. You will ask how many hours usually do you sleep, and do you have any snoring at all? If he had any partner that could not notice that. You will ask if you doze in the daytime, and if you wake up in the morning you feel like refreshed or not. You will ask about the energy level, and you will ask about the feeling of fatigue or tired in the day. And you will ask if he wake up early morning or midnight and that he couldn't sleep anymore. Also, you will ask about the bedroom situation, for instance, like if it's a comfortable room, if it's a cold or warm room, if there is light, noise. If, for instance, the patient takes like, drinking tea, coffee, alcohol, or eat before sleeping. You will ask about the sleep routine, and ask the patient if they go in a certain specific time to bed and wake up in the same time, or if it's not regular. Ask if they have any naps in the daytime, and also you will ask if the patient has any other medical condition that could affect his sleep, if he is in pain, for instance, or if it's something that's ongoing. You'll ask also if the patient is using the social media excessively, especially at night, and the blue light of the screen. You will ask about any medication the patient is taking, for instance. And after ruling out all of that important questions, you'll ask the patient if he had any thoughts or idea what might be the reason for this, and try to agree about a management plan to put in place between you and the patient. So you will suggest, for instance, lifestyle measures, and you will say about the sleep hygiene. So basically, you will tell the patient that try to stick to one time when to go bed and wake up in the morning. So your sleep cycle will be like regular, because the body sometimes will adapt to that and get used to it. Also, tell the patient about if the patient is using too much social media and using his mobile or the tablet before sleep, and the effect of the blue light. This will affect, of course, the melatonin, so you need to tell about this, and tell about ensuring that the place where he sleeps is totally dark, which won't affect the melatonin of the body. Also, try to advise about taking a warm bath, a relaxing one, before bedtime, and ensure that the bed is comfortable and warm enough. Also, inquire about the fitness level of the patient, if they do any sort of regular exercise or walking, which could help. as well on the day. Also ask about if the patient does smoke or drink alcohol or taking any tea or coffee or big meal before night, so advice to avoid that after 7 o'clock p.m. Avoid using, as I say, iPad or the tablet or the iPhone at night time. Also inquire if they have any issue with their sleeping and the snoring. As I say, if they have a partner who notes that, and if they wake up in the morning feeling refreshed or not, which could point out to obstructive sleep apnea. Needs, of course, treatment if the patient is slightly with a high BMI, which is basically obese, or they have thick neck. All of that point to obstructive sleep apnea. And after all of those measures, you can suggest something called CBT, so cognitive behavioral therapy with a counselor, or a therapist. This could help as well. So basically, he will take like sessions to talk about his thoughts and the behavior, which can be changed accordingly to improve the sleep. And also at the end, you could introduce certain medication which can be targeted to insomnia. So that's something else. If the previous measure did not work, say for instance, you could start with melatonin tablet, which will compensate for the melatonin of the body. And if this did not work, there's other sort of pills that can be given for a 6-month period of time, and should be introduced in slower dose, and then keep maintenance, and then withdraw it at lower dose, and not abruptly, because this could cause relapse. So that's basically, in short, about the main points to be covered around insomnia case station. Thank you.